Hi MOJEH, this is Dr. Aarti. I'm an internal medicine specialist, a lifestyle medicine physician, and a women's health advocate. So number one is skipped or irregular periods. Not getting a period for more than 42 days is not actually normal, and you should be seeking support for this. The second is bleeding between your cycles. Bleeding between your cycles shows that there is something abnormal happening. This could be either an issue with the hormones, or it could also be an anatomical issue with the cervix, or another issue of the female tract. And the third would be getting undue abnormal cramps or pain before or during your periods that's affecting your quality of life. I think more often than not we tend to normalize painful periods, but this is not necessarily something that's normal, and it could be an underlying health issue like endometriosis. So it's always important to make sure that you speak to your healthcare professional if any of these signs exist. So our stress hormone cortisol is essentially there in everyone, and it's required for us to get up in the morning, get to meetings, hit our deadlines. But when it's there for prolonged periods of time, or if it's high for a very long amount of time, it can actually disrupt women's hormones and women's health. The last thing your body wants to do when you are stressed or in a state of stress is think about hormonal health. So your body kind of goes on a backbench when you are in that state of chronic stress. So supplements that I swear by is number one, vitamin D. I think we're not checking this enough, and more often than not, women are deficient in it. Vitamin D plays a huge role in hormonal health. It affects women's health hormones, but it also affects hormones like insulin and blood sugar control. It's really important for muscle health as well as bone health. The second is creatine. We know more and more from our studies now that creatine helps to improve performance, it helps to improve cognition, and it helps to improve overall health. And in terms of lifestyle, I think big things I would focus on is strength training and improving quality sleep. My all-time quote has been progress over perfection. I always tell my patients, if you're 1% better today than you were yesterday, that's a massive win, and keep celebrating that. Thank you, MOJEH.